The 5 best foods for high blood pressure. Changing your diet to lower your cholesterol makes logical sense. After all, part of the cholesterol that gets up in arteries originates in diet. Changing your diet to regulate your blood pressure does not appear to be that simple. However, eating may have a direct and sometimes dramatic influence on blood pressure. While medication may be required to decrease your blood pressure, lowering high blood pressure at home is doable with little effort. Even if you're on medication, there are natural ways to lower your blood pressure. In addition to assessing whether you need drugs, which you should discuss with your doctor, healthy lifestyle changes can make a substantial impact in lowering high blood pressure. Try adding the foods we mention in this video to your daily diet to reduce your blood pressure at home. What is high blood pressure? Blood pressure is a measurement of pressure within our arteries, which are the tubes that transport blood out from the heart and deliver oxygen to the rest of our bodies. A blood pressure reading is made up of 2 numbers: systolic blood pressure, the top number, and diastolic blood pressure, the bottom number. According to the Centers for Disease Control and Prevention, blood pressure less than 120/80 millimeter of mercury is regarded as normal. High blood pressure is defined by the American Heart Association, AHA, and the American College of Cardiology as systolic readings between 120 and 129 millimeter of mercury, and diastolic readings less than 80 millimeter of mercury as of 2017. By 2021, approximately half of all people in the United States have high blood pressure. High blood pressure indicates that the pressure is consistently higher than your organs and arteries can bear. As a result, the heart and arteries have to work harder to provide blood and oxygen to the organs. When this happens, some of our organs stop working properly and/or die. For example, if the heart is repeatedly forced to pump against excessive blood pressure, the heart muscle might hypertrophy, enlarge, and finally lose its capacity to operate effectively. High blood pressure increases your chances of having a heart attack, stroke, death, renal failure, vision loss, or heart failure. What are the causes of high blood pressure? In many circumstances, determining the reason for high blood pressure might be challenging. At least 90% of blood pressure is defined as vital hypertension, which essentially means there is no distinct cause identified. According to the CDC, hypertension develops gradually and is frequently caused by unhealthy lifestyle choices such as a poor diet and a lack of exercise. Less than 10% of patients have identifiable causes of hypertension, which might include 1. Narrowing of the kidney arteries. 2. Thyroid abnormalities. 3. Tumors in the adrenal glands. 4. Aortic abnormalities. Other risk factors include 1. A family history of hypertension. 2. Obesity. 3. Physical inactivity. 4. A high salt diet. 5. Caffeine and alcohol usage. 6. Sleep apnea. Diabetes, according to the CDC, can also raise your risk too, and hypertension can emerge during pregnancy. Some medications, like oral contraceptives, nonsteroidal anti-inflammatory medicines, NSAIDs, like ibuprofen, corticosteroids, antidepressants, weight loss meds, and sodium-containing antacids can all aggravate hypertension. High blood pressure symptoms. High blood pressure is referred to as the silent killer by doctors and researchers since there are generally no symptoms, which is why it is critical to check your blood pressure, especially if you are already at risk. However, just a small number of people have symptoms. High blood pressure symptoms might include headache, poor vision, shortness of breath, urine with blood in it, dizziness, chest discomfort, and nosebleeds. What is the fastest way to lower blood pressure? Tufts Medical Center specialists propose the following steps to reduce your blood pressure in minutes. Take a warm shower or bath for at least 15 minutes to help relieve muscular tension. Take a deep breath in, hold it for 2 seconds, and then gently release. Repeat as required. Relax by meditating, going for a walk leisurely, reading, or stretching. But, according to Luke Laffin, MD, co-director of the Cleveland Clinic Center for Blood Pressure Disorders, one of the most simple methods to help regulate yours is to watch what you eat. One method is to follow the DASH, dietary approaches to stop hypertension, which is high in fruits, vegetables, lean meats, nuts, seeds, whole grains, and low-fat dairy. An analysis of 30 randomized controlled studies published in the journal Advances in Nutrition in 2020 revealed that persons who followed the DASH diet had substantial decreases in blood pressure, even if they did not previously have hypertension when compared to control groups. Previous studies revealed that adopting the low-sodium DASH diet decreased blood pressure by roughly 11 points in hypertensive people. It's the same as taking 1 or 2 blood pressure pills. To bring blood pressure under control, it's important to focus on an overall healthy eating pattern rather than one single food. All of these nutrients act together to provide a synergistic effect. Fruits, vegetables, and low-fat dairy are high in micronutrients, which work together to control blood pressure. They also serve to substitute more harmful foods that might raise blood pressure, such as salty snacks. However, there are some specific foods that you should include in your diet since they are high in nutrients that help in decreasing blood pressure. So here are the 5 best foods for high blood pressure. 1. Citrus fruit. Citrus fruits may aid in blood pressure control. They're abundant in vitamins, minerals, and plant chemicals, which may help keep your heart healthy by lowering risk factors for heart disease, such as high blood pressure. Citrus fruits include grapefruit, oranges, and lemons. A 2021 research examined the previous 10 years of data on fruits and high blood pressure management. The researchers discovered that consuming 530 to 600 grams of fruit per day, approximately 4 oranges, was useful for blood pressure management. Citrus fruits, in particular, have been associated with a decreased risk of high blood pressure by researchers. Orange and grapefruit juice may help lower blood pressure. However, grapefruit and grapefruit juice can interact with common blood pressure drugs, so talk to your doctor before including this fruit in your diet. 2. Salmon and other fatty fish. Fatty fish are high in omega-3 fats, which have been linked to improved heart health. These fats may help decrease blood pressure by reducing inflammation. A 2022 study examined 71 papers and 4,973 people's health data to investigate the association between omega-3 fats from diet or supplements and blood pressure. A daily dose of 2 to 3 grams of omega-3 fats, about a 3.5-ounce meal of salmon, had the most effect on decreasing blood pressure. Higher omega-3 fat levels in the diet, especially fish, may also reduce the incidence of hypertension in young people without a history of heart disease or diabetes. 3. Leafy greens. Leafy greens such as Swiss chard and spinach are examples of foods that may help reduce blood pressure. These leafy greens provide minerals like potassium and magnesium, which help maintain healthy blood pressure levels. 1 cup, 175 grams, cooked Swiss chard, for example, provides 20% and 36% of your daily potassium and magnesium needs, respectively. A 2022 research discovered that among females with high salt levels in their food, every 1 gram increase in daily potassium from the diet was associated with a 2.4 millimeters of mercury lower SBP. Spinach is a leafy green heavy in nitrate, a plant-based chemical that may decrease blood pressure. It's also high in antioxidants, potassium, calcium, and magnesium, which can help with heart health. An older small research of 27 persons reported that those who ate 16.9 ounces, 500 milliliters of high nitrate spinach soup every day for 7 days had lower SBP and DBP than those who had low nitrate asparagus soup. A more recent clinical study does not demonstrate a similar benefit of high nitrate leafy greens on decreasing blood pressure, thus further research is needed to further investigate these findings. 4. Eggs. Eggs are not only nutrient-dense, but research shows that they may be part of a healthy dietary plan for blood pressure control. A 2023 research of 2,349 individuals in the United States discovered that eating 5 eggs or more per week was associated with a 2.5 millimeters of mercury lower SBP level than persons who ate less than half an egg per week. Egg eaters also had a considerably decreased long-term risk of acquiring high blood pressure. Eating eggs does not appear to be associated with any additional risk factors for heart disease beyond blood pressure, and the newest research appears to support people with excellent health eating up to 3 eggs per day. 5. Tomatoes and tomato products. Tomatoes and tomato products are high in potassium as well as the carotenoid pigment lycopene. Lycopene has been related to considerable heart health benefits, and consuming foods high in this vitamin may help lower heart disease risk factors such as high blood pressure. A meta-analysis of 21 research found that eating tomatoes and tomato products lowers blood pressure and may lower your risk of heart disease and death from heart disease. More research is needed since additional studies have revealed an uneven link between a tomato-rich diet and blood pressure. Well, there you have it, 5 best foods for high blood pressure. Hope the video helped. Thanks for watching.